He is the master trainer for the dynamic navigation in dental implantology. Today his lecture will be about mapping virtual to reality. Dr. Khoury, the stage is yours. You're most welcome.
Morning. I would like to thank our order to give me this opportunity to present for you the latest in dentistry. It means this is a kind of things we will present it. It is useful for every dentist. Every dentist did it because in our after a long experience, after a long mistake done, I found myself it's unallowed for us to do an implant from now on without using this technology, starting with the CBCT and continuing with all those things to give us the opportunity to do the good job. What is the dynamic navigation surgery? It is based on a software who guide us to do, as we know, our work is not only scientific, or it's scientific, but it is based on science on our hand on. We should be an engineer beside our science and the medicine, we should know it. Starting 2000, it was a time when the dynamic navigation started to be used in dentistry, and in 2003 it was specially used with neurosurgeon and in different discipline, and in 2003 it started to be used in dentistry, and these things get the FDA approved. And the pioneer of dynamic navigation surgery is a company called Navident, who do this software for neurosurgeon and adapt it later on for practical use in dentistry or in implantology. What is this technology? This technology is like a GPS. All of us know or use a GPS in our car, and we know the GPS is connected to a satellite, and we are the driver, and there are a screen on the car, and connecting the three of us in this system, in this software, we are able to drive our car safety, avoid a lot of accident. And now on we heard a lot that the car from now on we will not don't need even a driver. Using the GPS, he can drive the car alone. So, but here with Navident, we should and we still need a dentist to do his job. So it is the camera. I present the system now. It is the camera. It's work like a satellite. It is instead of a satellite in our office. It is this computer where we have the software facing us, and in our hand and connecting to the patient too. They are two sensors, one in our hand and one in the mouth of the patient. But now on, we don't need any sensor even in the mouth of the patient. We can connect it magnetically or via to the computer. First of all, we start to do a plan. We plan our implant, which was combining the best place to do our prostolator or the things we need. After planning in implant, those we are showing are the tracking or the sensor. I mentioned them before. This sensor in the hand of the dentist is connected, as I said before. We will explain later all those details. Now it's a small briefing as an introduction for the system. And in the mouth of the patient, it is a stand. Now, to connect the patient, there are three ways to connect it. We will speak about them later. There are the stand. There are some indication to use it. There are the trace and place, where nothing in the mouth of the patient is free. It is not nothing, no sensor in it. It is connected via other way, and the bone anchorage system with the dental patient. So the navigant or this dynamic navigation, it help us in surgery, in different kind of surgery. What is this? Whatever is the situation of our patient, and beside, it help us in endodonty treatment, where if we have calcified canal or a canal we are unable to found it. We will speak about it later. And also it help us in any kind of surgery to harvest a block bone, or to make a canal resection. Any kind of surgery, we can do it safely and in the correct way, because everything is behind us or facing us on the screen, so no way to have a mistake. Like if we are driving our car and we want to change the road, if we go in wrong way, there's someone who tell us the GPS, no, wrong way, turn on. The benefit of it, so we do a better job, increase our efficiency, reduce treatment cost, we can explain it later, attract referrals. So I think it is not so necessary that all of us, it's better to have everyone have it at his office. If not, it could be a work group, and relax and enjoy, because everything should be done correctly. If we have bad chance, we have bad result. It depends on the physiology of our patient, but technically our work with it should be done good. And if we compare it to, because a lot of us will say we have for what to pay the software, and we have another choice is static navigation. There are a big difference. With the static navigation, no one even is able to do on the site, and in short time is implant. We know we need the laboratory work, and it is cost more money, and beside it need more time. And we all of us know that our patient now is all our us don't have time, so everything should be done as shorter as we can. So it gives us the answers. So a minimally invasive option, accuracy check in real time. We will show you that during the live surgery, increased precision and ability to adjust surgical plan during surgical procedure. Sometimes using a static, we are obliged to follow the plan, but when sometimes we found that working, we should change our plan. But if we are using a static navigation, so we cannot. Here we can modify our plan during our work. That is, I will leave the stage now for my colleague, my friend. He was coming from Claronav to details all things I presented. We have to I welcome Gianluigi Telara, coming specially for this presentation from Italy, and to share with us all his knowledge. Thank you.